Great to see you, Simon. Great to be back this month's CFP Distilled.
I'm Simon Moore.
I'm Dr. Paul Dillon.
Let's dive into the November 2022 CFP Journal and find out what are the clinically relevant articles you need to know.
What about the cover?
Oh, of course. We
What
always
about
have
the
to
cover?
start with a cover
You know what?
critique.
I think I really like that. I think they've got a little bit more advanced, it's still abstract. This guy doesn't know whether he's going east, west, or north, practice versus retirement, covering the entire spectrum. But let's dive into the 3 articles that we're going to talk about. First, we're going to talk about screening tests. How do you evaluate a screening test? Next is going to be a dirty topic, diarrhea, and
The final one that we're going to talk about, and I would say stay tuned for this one, practice changer. I'm going to use it in my clinic. Which antidepressant do you select? An amazing tool you can pull up at the bedside. So let's start with screening tools.
So screening tools, we all want to be like frequent adopters, rapid adopters. New screening test comes out, we want to use it, but we have to remember, what is a screening test for? It's essentially a sieve for a large patient population. So what do you have to ask yourself about your patient sitting in front of you before you start using a new screening test?
I can see this being a great SAMP question. They want to know that you know about clinical care, family medicine, but also when it comes to testing and good choices of screening tools. So what kinds of things should we study for our SAMPs?
So a full body MRI for all your patients? Well, the answer is going to be no. You're going to think about the downstream effects. What are the possible harms? What are the possible benefits to your patient? There's a great box 2 in this article. That's the one to know for when you're studying for the CCFP exam.
Great article from Tools for Practice, an amazing group out of Alberta. They always look at the recent evidence, the recent literature, and come up with a bottom line for what do we need to know in clinical practice. So the first thing to know about this one is it's on diarrhea. Breastfed and formula-fed kids, if they get a stomach bug, they get diarrhea, what should we be doing when it comes to their feeding?
So there's a thought that, maybe we should hold back on any lactose-containing products. Not great evidence, I think, is the bottom line. The answer is maybe.
Yeah, the evidence, it's old, it's a lot of confounding factors, but we do know that if they are formula fed and they've got diarrhea, you want to cut back on the lactose containing formula. Switch to a lactose-free formula because that can shorten the duration of diarrhea by about 18 hours.
And 18 hours for anyone out there who have children, or maybe have experienced children with diarrhea, that is a long time.
What about the breastfed kids? Keep breastfeeding.
Let's get on to that one article you need to know from this month's CFP Distilled, and I've bookmarked it here. It's on antidepressants and a really nice one-pager, Simon.
Exactly. So we're going to put up on the screen this beautiful flow chart because we all know that people come to your clinic, they say, which antidepressant should I start on? And at the end of the day, the evidence says that they're all equivalent at improving depression symptoms. So what should we do when we're choosing one?
I think my biggest takeaway from here is to look at the comorbidities, and it's laid out really nicely because most patients with depression, I should say a lot of them, not most, will have some sort of comorbidity, and that chart really lays out how you can utilize your choice in antidepressant to work at those 2 problems together concurrently.
And let's take a look at page 2. If we put that up on the screen, you're going to see that there's other considerations, cost, can the pill be crushed? And these things are all going to come into mind when you're trying to select an antidepressant for your patient. A couple of really good examples. Patient with stress urinary incontinence, there's a specific antidepressant that would be a better first-line choice for them. So take a look at that. Chronic pain, cardiovascular disease, it's a fantastic tool. Definitely going to use it in my practice.
That's it for this month.
Make sure if you're studying for the CCFP exam, take a look at the reviewcourse.com/exam essentials. There's all sorts of stuff there. You need to know what kinds of things can we find there.
You can find links to places to go study, to look at the SUS online, to look at old resources, and look at all of the resources peer-reviewed across the country just for you.
Spend some time learning about the software, what it's going to look like on exam day. So on behalf of the Review Course in Family Medicine and CFP Distilled, I'm Dr. Simon Moore.
And I'm Dr. Paul Dillon. We'll see you next month.